name's Jeff. I am just going to take you through how to use the doctor's ABCD algorithm and use of an automated external defibrillator. The doctor's ABCD algorithm is designed to help you approach a collapsed person and just try and figure out what exactly needs to be done for them. So firstly, the D is check for danger. So please always make sure that you're safe. And danger can take many forms. If you're at a motor vehicle accident, obviously there is a huge range of dangers there. It could be water, it could be power lines, it could be an electrical wire, it just might be something you can fall over. If at any stage you think that there is a danger to yourself, please don't get involved. Wait for the appropriate emergency services to turn up and then let them get on with their job. Once you've made sure that it's safe, you want to check how responsive this person is, and this is very much a staged approach. First and foremost, we want to see if they're alert. So if this person's looking at you, then they are alert. If they're not looking at you, then we want to see if they wake up to voice, so you get to yell at them. And it's as nice and easy as, "Hello, hello, can you hear me, hello?" If they don't wake up to voice, then you get to inflict some pain on them. In terms of inflicting pain on this person, it has to be two things. Firstly, it has to be a fair amount of pain. Secondly, it has to look somewhat professional whilst you're doing it. Personally, there's two ways that I use to inflict pain. Firstly, with my fingertips, I give this person several solid taps on their collarbone. So firstly, that's annoying and it's also painful. Okay, if I don't use that way, the second way that I use is grab their trapezius muscle. Some people call this doing the Dr. Spock, and I squeeze as hard as I can. This is extremely painful, and either of those ways will wake somebody up if they are going to wake up. If this person doesn't wake up to pain, then they are unresponsive, and that's important because unresponsiveness is one of the indicators for starting CPR. Obviously, if they are unresponsive, they are going to need some help, and you're going to need some more help as well. And so that's why the S part of the doctor's ABCD algorithm is send for help. And there are very specific ways that we send for help. So firstly, try and identify a colleague by name. If you don't know their name, ask them their name. And this is the way to do it. Excuse me, what's your name?
Mike.
Mike, can you please go and phone 111? Tell them we've got a person that has collapsed. Can you please grab a defibrillator if there's one round and come back and let me know when you've done that, please?
Sure.
So try and keep your instructions nice and simple. So I've identified Mike by name. If you can use a person's name, they're more likely to do that. And then I kept my instructions nice and simple. Phone 111. If you work somewhere that has an extra number that you need to dial, just keep that in the back of your mind that you might need to dial a 9 or a 1 at the start of those ones. I asked Mike to tell the ambulance that we had a person that was collapsed, to grab a defibrillator, and lastly to come back and let me know when he'd done that. So if Mike comes back, that's great because he can say it's so many minutes until the ambulance is going to be here, and hopefully he will come with a defibrillator as well. Whilst we're waiting for our colleague to come back with the defibrillator and also an ETA on the ambulance, we can get on with the C part of the algorithm, which is good old chest compressions. Chest compressions are really important. They need to happen for about 98% of the resuscitation, so they just keep going and going and going. All right, and there's a few things to think about with chest compressions. Firstly, you want to get your hand into the correct position, okay, and that's somewhere around the centre of this person's chest or just below. The easiest way to find that is put your hand into their armpit, drag it across and over onto their sternum, which is the bony part in the centre of their chest, and then that's the ideal position to push. Put your other hand on top, okay, keep your elbows locked so we're not going to do bendy CPR. And ideally, you're going to have your knees as close to this person as possible because you really want to use your body weight to drive these compressions. I always aim to have the centre of my chest over the centre of this person's chest, okay, and that kind of stops me rocking when I'm doing CPR as well. So you'll notice that all the movement comes from my hips when I'm doing this. Okay. There's a few other things to think about. We want to push down about a third of the depth of this person's chest. We also want to allow the chest to fully come back up after every chest compression. And lastly, we want to push at least 100 times per minute. Okay, so notice that I'm pushing down a good depth. I'm also allowing the chest to fully come back up, so I'm not kind of resting on this person trying to do CPR like that, because that's just not effective. And then this is my job until the defibrillator and more help arrives.
Called for the ambulance in, which is 10 minutes away. Here's an AED.
Beautiful, thank you. Right, so in an ideal situation, we would have a colleague continuing to do chest compressions. Just for the purposes of this training video, we're not going to have that, and we're now going to focus on how to use an automated defibrillator. These are designed to be really, really easy. Everything that you need is here ready to go. So we've got the defibrillator ready for action, and we've got the pads or the electrodes ready to go as well. First step with any defibrillator is obviously get it out of its packet and then turn it on. So it doesn't matter what type or what model of AED that you're using, turn it on and it will tell you exactly what you need to do. This particular model does have instructions on it as well that again just give you some extra prompts about what you need to do. Okay, so firstly I'm going to turn it on and then listen to its instructions.
Check the electrodes.
Okay, so these are the electrodes here,
Check the electrodes.
all the pads. Okay, so all we need to do is pull the pads
Check
out.
the electrodes.
These ones do have nice little diagrams that tell you approximately where the
Check the
pads should go.
electrodes.
Okay, so ideally you're going to stick the pads in line with
Check the
these
electrodes.
diagrams. If you happen to get them round the wrong way, please don't try and
Check the
remove them,
electrodes.
just leave them on.
Check the
So
electrodes.
one goes on the right side of the person's chest, just below the clavicle,
Check the
or the
electrodes.
collarbone. The other one goes on the left side of their chest.
Check the electrodes.
And the key with this one is that it goes on the chest wall. So particularly if there's birds in the road, you will need to get them up out of the road to get the pad on. If this person has a bra on and it doesn't interfere with you getting the pads on, feel free to leave the bra on because it just keeps everything
Check the
contained.
electrodes.
Also notice with this pad placement that I don't need to stop chest compressions if I'm the person doing the chest compressions, because I am doing the most important job.
Check the electrodes.
So your colleague who is applying the defib pads will have to work around you.
Check the electrodes.
Once the pads are on, the connector at the end plugs in here. It will only go one way.
Check the electrodes. Check the electrodes.
And then follow its instructions.
Analyzing. Do not touch the
Okay,
patient.
so do not touch the patient. If you're using the defibrillator, please tell your colleagues to step away because they will not be listening to the defibrillator.
Press the flashing shock
A
button.
good look round, big arm sweep, tell them to stand back.
Press the
Once
flashing
it's safe,
shock button.
push the button,
Shock delivered.
and then it's straight back into chest compressions.
Patient may be touched. Carry on CPR. Give 30 chest compressions and 2 mouth-to-mouth breaths. Then repeat the cycle.
So the beeping that you can hear is a little metronome that is built into this model of defibrillator. That is indicating 100 times per minute. So that's the speed you want to push at. Okay, it also stops so you can give mouth to mouth if you want to. Okay, if you're going to do mouth to mouth, pinch the nose and then give 2 attempted breaths. If you don't want to do mouth to mouth, that's fine, just keep going with chest compressions. After 2 minutes of this, the defibrillator is going to tell you to stop, and then it is going to have a look at the person's rhythm. If it sees a shockable rhythm, again it will say shock advised. If it sees a non-shockable rhythm, it will say shock not advised, and that's just your cue to get straight back into chest compressions again. Okay, and we keep going with chest compressions and defibrillating until either this person starts to become responsive or they start to breathe normally. Otherwise, just keep going and wait till the ambulance arrives. They will get themselves ready and they'll let you know when they're ready to take over from you.